Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. We're helping El Paso help their pets. So today I want to talk about rabies. Recently in Facebook there was an article going around about a recent rabies case in El Paso County, Colorado. So not here in El Paso County, Texas, but in Colorado, but still, brought up a good point that we need to discuss and be aware of rabies and understand how it's passed. A lot of times we have people coming into the clinic and saying, oh, it's getting hot outside, so I need to get the rabies vaccine. The weather has nothing to do with rabies, and it's not a virus that can be passed like the flu virus. It has to be injected into the tissue by a bite wound. There are some controversies about whether or not it can be passed by the saliva, the spittle spraying into eyes or mouth, or maybe a cut on the lip or something like that. And so those are potentially thought possible. But the main way, 99.9999999% of the time, the way that rabies is passed is through an injection via a bite. And so rabies is a virus that affects the nervous system. When it affects the nervous system, it causes behavior changes anywhere from aggression and salivation, and then progresses into paralysis. And that's why people say they have a fear of water. They don't really have a fear of water. They just start to become paralyzed, so they can't drink the water. And then they have the behavior changes, which cause them to be aggressive and thus bite other animals or people and pass the virus on. There are no mammals anywhere that are immune to rabies. If an animal is bit with rabies, it will die. The thing is that, and there are no carriers, they will eventually die. A carrier means that they live forever and just carry that virus around. That doesn't happen. They will die. And what happens is that there is a very long progression period from when they are bit originally to when they actually show signs. And that's why people say that they're carriers. They're not true carriers. It just can take anywhere from 10 days up to 6 months or more for them to show symptoms from when they've been exposed. And during that latter period, they can pass that virus on by biting others. So in the beginning, they don't show any symptoms because it takes a while to travel up the nerves to the brain. So for example, if a human or an animal is bit on the toe of the back foot, or of the foot, then it's going to take a long time to travel up those leg nerves, on up the spine to the brain. And so symptoms will be shown a lot slower. However, if something is mauled on the head or face, then obviously that's not going to take very long to show those symptoms. And they'll come up very quickly, and the pet will become, have those changes immediately, or not immediately, but very quickly, and then pass away. And so those things that we're seeing, the behavior, it starts with neurologic symptoms. So you can have anywhere from aggression and behavior changes, and then it progresses into paralysis. And people say that they're afraid of water. Well, they're not really afraid of water. What happens is that they start to become paralyzed in the esophagus and the trachea and things like that. So that's why they salivate, because they can't swallow. And that's why they say that they're afraid of water, because they can't actually drink. So they become dehydrated. They try to drink, but their esophagus is paralyzed, so they can't actually drink the water. And the aggression and behavior changes become worse and worse until they start biting others and passing that virus on to others, and then eventually become totally paralyzed and die. And so rabies is always a fatal disease. That's why it's so important that we vaccinate, not only because it's always a fatal disease, but because it can be transmitted to humans, and even in humans it's always a fatal disease. Even if you do have rabies vaccines, which are not very common, except for in the medical fields, even if you do have rabies vaccines, you still have to get vaccines afterwards, and your chances of survival are still very low. We cannot test for rabies in a live animal. We have to euthanize the animal and send off the brain for analysis. That's the only way of testing. And so they do little samples of the brain where they look at it under a microscope and look for specific little particles that get into the cells of the brain, and that's what causes the neurologic symptoms and the behavior changes. And so it is a difficult disease because it's hard to catch. It can take anywhere from 10 days to 6 months or more to show symptoms. It's hard to test for because you have to have the patient's brain to test for it. And it is always fatal, and it's transmissible to humans and other animals. So just make sure that you're keeping up with your rabies vaccine. Number one, it's by law, so you don't want to get fined. Number two, if the pet is not up to date and gets, in a dog fight or attacks somebody or accidentally bites somebody because they're playing ball with them or something, and they're not up to date, they're going to be quarantined. It depends on the city. Every city has its own laws, but they will be quarantined, which is quite expensive. And we can't do vaccines until they finish their quarantine because we don't want to cause any behavior changes with the vaccines. And so, not having the rabies vaccine poses a lot of risks to yourself, not only health risks, but also financial risks. So make sure that you're keeping up with that rabies vaccine. Some counties and cities require it every year. Some are allowing the 3-year. Most are nowadays allowing the 3-year, and along with the city license and such. A lot of cities are also requiring the microchip, like El Paso. And so it's just a good idea to keep up with all of that and make sure that everybody's staying healthy and that there's no risk at all. Even in horses, we have a lot of controversy by horse owners if rabies vaccine is necessary. But we just had rabies in a county in Colorado, and any one of those, potentials could be a horse. And if the horse is not vaccinated, then it will do the exact same thing as a dog, and it will pass on the disease to humans and other animals. So all of the animals should be vaccinated for rabies to keep everyone healthy and safe. If you have any questions, please comment and subscribe, and look forward to talking to you next time. Bye-bye.